I'm Jennifer DeSablo, host of Franklin County Home Health Agency's Where the Heart Is. Franklin County Home Health Agency is a nonprofit home health care organization that has been providing home health care and hospice to people of all ages throughout Franklin County since 1969. We're happy to bring you this monthly show dedicated to providing information about our agency's programs and services, as well as helpful tips to help you stay safe and healthy at home. On today's program, we will be discussing home health care reform in Vermont. With the passing of the Affordable Care Act, healthcare reform is here in Vermont and nationally, and it's here to stay. So today we are interested in what healthcare reform in Vermont means locally. We are very fortunate to have a wonderful system of healthcare providers in Franklin County, from primary care physicians, nursing homes, and facilities. And I have three guests with me today from three significant healthcare providers in our community. I welcome you each here today. I'd like to welcome Jill Barry Bowen, the Chief Executive Officer at Northwestern Medical Center. And Joe Halko, the Community Relations Director at Northwestern Counseling and Support Services. Thank you, Joe. And Janet McCarthy, Franklin County Home Health Agency's Executive Director. So thank you each for being here today.
You're welcome.
Thank you.
Pleasure.
So I had mentioned healthcare reform in Vermont. Healthcare reform is designed to provide affordable care, access to care, and improved quality of care. So before we start talking about that, I just want to get a snapshot of your organizations and who we are serving in Franklin County. So Jill, tell us a little bit about the hospital, how many people you employ, and the people that you serve.
Sure, I'd be happy to. So we actually employ about 715 employees, so we're certainly one of the largest employers in the area. And our span is Franklin and Grand Isle County, so we about 55,000 people that we serve.
It's a lot of people.
It is, it is.
Great. And Joe, what about Northwestern Counseling and Support Services?
And we very much the same, have the two-county catchment area, so the overall service area being 55,000. NCSS has slightly over 500 staff members, and of those that we specifically serve, unduplicated in a given year, it's a little over 4,000 of those individuals that we serve.
Great, thank you. And home health.
And we're the tiny organization of the three here. So we employ about 250 employees. We serve about 2,500 unduplicated persons each year. And I think we're going to approach about 90,000 visits throughout Franklin County this year.
So, and unlike these organizations, we're specific to Franklin County, but still
That's correct. We have two offices, one in St. Albans and one in Enosburg.
Wonderful. So Northwestern Medical Center, Northwest Counseling and Support Services, and Franklin County Home Health all have long histories here in our community, and you have a long history of working together.
Yes.
So let's talk about healthcare reform and what's the difference. So if healthcare reform is designed to provide great access and affordable care and quality care, what are people going to see as a difference now compared to what we have been doing? And any one of you can start taking that.
Well, I think I will start, and I think how this is impacting our community. And I think what I'm seeing different is an infrastructure to support the reform initiatives. And so at the state level, accountable care organizations that we're a part of, and then how we're working locally with a regional performance council to bring all of the healthcare providers together. So what is different from my perspective is that even though we've been talking about transitions of care and coordination of care, is that we really have a momentum that's bringing us together. We're actually looking at outcomes now, and so if we look at someone with heart disease, then we're rallying around that particular patient and making sure we're doing things the same way, and even maybe across the state. So it's a shared vision, shared goals, and I think we're evolving in a greater trust level across our healthcare communities that we're sharing these patients collectively. And for the patient's perspective, I think they're seeing more seamless care and the focus on the primary care as the anchor to their world. But with great relationships, the handoffs are powerful. So to the patient, they're not getting lost in the system. We still have work to do, but I love this integration that's happening, and that feels different to me.
Absolutely. Yeah, the access, care, and quality, as Jill said, and really when you look at it, this whole outcome-based scenario, and I know outcomes, everybody's talking about RBA, which is results-based accountability, which is a Mark Friedman model that was brought to the state, I believe, about 15 years ago initially. And I know NCSS has been using that in our world, but it was in our world only, where we were using RBA for about the last 14 years. Now you take that and extrapolate that over the individual, the patient, with everything that they're going to be encountering as far as their well-being. And that will have substantial results in the future.
So patient-centered accountability.
Patient-centered,
and
yes.
results.
Medical home, patient-centered. As Jill said, one of the things that's going to change, I believe, dramatically, and I know I'm on the sidelines because I'm not at the hospital, but as you look at it, you see all of a sudden that the primary care provider is such an anchor in this that they are going to be invaluable in this whole process. It's a real shift from, I think, the way we look at specialists and that sort of thing doesn't mean certainly they're not going to be involved, but the point is the key is going to be at the primary care level and that the patient gets everything that they need.
Our healthcare system has been broken for a long time, and there have been a number of attempts throughout the years to make improvements. So in the 80s, there was the introduction of the HMOs, health maintenance organizations, as a way to control costs and have the primary care physician take a more active role in the care of the patient. But we still did not achieve quality outcomes, and we never really did achieve cost savings. And certainly the patient's experience didn't change. So the triple aim of healthcare reform these days are really bringing those three things into alignment. Improve patient experience, improve patient outcomes, and reduce costs to the system. So I personally find that very exciting, having been in healthcare for a long time, to see things really starting to come together, and as Jill said, integration of the work that we all do in our community.
Yeah.
And let's talk about some of that work. Let's talk specifically some of the new initiatives or things that you have done leading up to this change. But for instance, at the hospital recently we had a staff meeting talk about communication with the hospital, sharing with home health staff about what they were doing in the emergency department and what's new there. Or other urgent care. I know you have a new urgent care system and other projects you're involved with, if you want to touch on Project Rise. So if you could tell us some of the initiatives at the hospital.
Sure. So what we've been talking about is really that care coordination, both inside our organizations and across the community. So inside our organization, the emergency department, we had a number of patients that were using emergency department as primary care. And so we've invested in primary care, not just the hospital, but others who are providing primary care in the community, to make sure that if we're going to care manage folks, to say, where's the best place for you to get your care, then we have a place for them to actually go to get primary care, of course, mental health and other programs. So we put a case manager in our emergency department full-time to work with patients on why they actually came to us for their level of care, which is non-emergent, and how can we help them connect to a primary care provider or mental health or whatever it might be. So there's like care coordination going. And so it was a resource that partnered not only inside the hospital, but partnered with others outside to make sure those connections were being made. And it's been wildly successful because our goal was to reduce the number of ED visits that could be avoided because of good connections in the community. And so that was very, very successful. Now, urgent care, because I don't want to take all the time, because I can talk about a lot of things. We all have great programs that going on, and I think what we do, we kind of look to each other to be complementary. But we've had a walk-in or urgent care in Georgia, just 8 miles south of center here, and we have found that that has been a nice fit for the community when their primary care provider may not be available, and they are learning not to choose the emergency department for those types of things. So we're sort of filling a gap by opening one in St. Albans, and we have been overwhelmed with the support, not only with our open house, but people coming and saying, thank you so much. I couldn't get in today to my primary care provider, or it's the weekend or what have you, and I just couldn't wait to do that, but I didn't choose the emergency department. So it's a nice option sort of in the middle. Now, Rise Vermont, I just came from a meeting from Rise Vermont, so as an energized group of representing the community, not just healthcare providers, in fact, very little about healthcare, but looking at our representation across the entire community to look at population health. And unfortunately, we're known for a lot of great things in this community. But one of the things that we stand out in Franklin and Grand Isle County is obesity for both adults and children. And so how do we bend that curve? So when you think about bending the cost curve, I think we have to start at the beginning and really be teaching wellness and prevention as a way of life in families and businesses and school systems. So with this group, we've come up with some things to do to work with the community, like safe routes to school, biking paths, and making sure every community has walking trails and things like that. And what are the healthy options for both food in the community and nutrition? And so really engaging the community. So we're submitting, grants for it. We want to have a coordinator, but there's a lot of energy of different levels people can participate at to become a RISE Vermont business or community or participant. So I can certainly give a lot more details, but it's a grassroots community initiative to improve the health, and the vision is of communities embracing healthy lifestyles.
I love that, and it speaks to that, the prevention, but also giving power to the individual. So just like you said, with people learning about when to go to the ED and giving them that support of here's places you can go, people utilizing urgent care when they need to, it sounds like you're giving a lot of empowerment back to the patient. And then of course wellness activities will do that in the long run. So that's good to hear about. Excellent.
Exactly, it really does. How do you get the individual involved? Because really bending the cost curve and thinking about these chronic disease, how do you start the individual?
Yeah.
And it's empowering to them.
Excellent, thank you.
And one of the things, Jill brought up the emergency department, and certainly all of us are trying to figure out ways to divert people from going there at every turn if we can. And one of the things that we've done is we came up with a two-bed crisis program to try to divert people that are very difficult, that have mental health needs as well, and hopefully be able to handle that situation without them going to the emergency department, and trying again in some fashion to help reduce the activity there for individuals that quite frankly are very difficult for the staff to deal with. That's one of the things. The other thing is that we have social workers in all but 2 of the primary care providers now. I think if you were to look at Vermont overall as a state, Franklin County is leading the way when it comes to some of the integration models and methods that are being used. And later, if we have an opportunity, I'll share something from a survey from patients who receive those services and how they're feeling.
Yes, yeah. So it's really making it easier for patients to get the care that they need. So they're already involved with Northwest Counseling. They can get that same kind of care that they would have had to leave sort of the organization to get, and seamless communication, and it sounds like it's a real benefit to
Or you have someone who's at their primary care provider for a physical reason, but they also have a mental situation that the primary care provider, quite frankly, says, I need to hand that off. I need someone who's got that expertise. Well, now you do what they call the soft handoff to that individual who can then deal with that as well. So now you're dealing with the entire whole person and hopefully their well-being.
And everybody's aware, the doctor's aware of what's happening, because there's better communication there. That's excellent.
And some of that work has been spurred by the work that's been done in our community around the Blueprint for Health. So that was an initiative that was started in Vermont about 3 or 4 years ago to help to support medical homes, primary care practices. And although Franklin County was fairly late coming to the table, I think they have really benefited from the work that's been done in other communities across the state to learn what has worked, what hasn't worked. We heard the other night that we seem to be very far along and very integrated in and doing something different in our community to support primary care practices and improve the health of our patient population. So it's really, I think, a real kudo to our community for the collaboration that has occurred and continues to occur.
Definitely is.
And Janet, just to give home health a chance, activities that you've done to, well, I know we've always focused on reducing unnecessary hospitalizations, but do you want to talk more about some of the new initiatives at home health?
So I think the emergency department is a good example of where we actually have just begun another project to complement the work that's already been done in the community, and that's trying to improve our care coordination, our communication with the patients that Franklin County Home Health serves that may be using the emergency department for any of the hospitals. So we're looking at some standardized practices and transitions of care once again to try to reduce those numbers as well. The emergency department care is not always the best care for that for the reason somebody comes in, and so it's important to that. Some of the other kinds of things that we're looking at, we're continuing to look at reducing avoidable hospital readmissions. We've had some very significant success in that through the implementation of our telemonitoring program, where we bring equipment out to patients' home and we can remotely monitor blood pressure, their weight, respirations, the amount of oxygen in their blood, and asking some general questions. And that comes back to a nurse in our office who monitors through the use of a computer and can provide some interventions in a very cost-effective way, and really help that.
And another place where the patient is learning about self-care and what's important.
Absolutely, yeah, absolutely.
So a nice segue of talking about outcomes, and this is a nice opportunity, Joe, if you want to share some of the results you saw. You mentioned a patient satisfaction survey.
I will, if I can locate that. Yeah, one of the interesting things, again, when we talk about the well-being of the patient and the overall care that they can receive at one stop, meaning in a primary or their medical home, wherever that is. From our blueprint work that we've done with all the organizations that are sitting here at the table, plus the Department of Health and others, there was a patient satisfaction survey that they did last fall. And they asked a number of questions of those that were served, and they wanted to know whether getting the mental health in the primary care was valuable or not. And I'll just go through a couple of things here. Am I satisfied with how the team treated me? And when they say the team, they mean the community health team, which is part of the blueprint. 76% strongly agreed. And we have I think we all do, we have various categories people can rate you in, but strongly agree is really the one you look at. The other ones, that's nice, but you really want somebody to be feeling that you're providing quality service. Am I better off as a result of the help that I received from the community health team? 74% said yes. Now remember, this is a new initiative, so those are pretty good numbers. And then the last thing I'll mention is they were asked, I would recommend the community health team to my friends and family. 82% said yes on that. So, and if I could give one quote, a patient said, "This program is a godsend. I am so happy that Dr. Nunez introduced me to Meg." Meg would be the social worker. She is a great listener and has very helpful responses. Her attitude is contagious. So to the point that we were making earlier is that you've got a patient who's struggling with a variety of things, and if you can try to deal with as much as you can in one visit, I think the well-being of the individual is going to be served a lot sooner.
Absolutely. And beyond physical health, it's our mental well-being when we're dealing with so many issues that are in our health care. That can be very stressful, and if we can reduce that for patients, it's a job well done. So.
So Joe's presentation of the satisfaction kind of reminds me that one of the things that as healthcare reform efforts continue, something that someone might see as a patient is more opportunities to provide feedback. So I know that the hospital has patient satisfaction surveys, and I know home health has patient satisfaction surveys, primary care, and I'm not sure about mental health, but
yeah, we do.
you know, I think that our community can expect to see more of that, and we really do want and value the feedback that we receive. So if you get one of those surveys in the mail, please do take the time to fill it out, because it's enormously valuable and helps us to decide where we need to improve our efforts.
So how are we doing? Are we already seeing results on costs? Have they studied that and are seeing results this early in the game, or do we know yet as far as how this is affecting healthcare costs?
Well, I think overall, I mean, we just saw a presentation from Craig Jones, who is really the guru for our local blueprint, and what he's been able to present on his statewide initiative is that there is decreased in admissions to hospitals. There is increase in people actually going to primary care and getting that care coordination, and there is also a reduction in the use of specialty care as well. So that preventive work is improving, and so the numbers are suggesting that there is a reduction in overall cost, and that the quality of care is there and continues to improve. So there is certainly some, I mean, it's early, of course, still in all of this, but there is definitely reason to believe, and his numbers statewide suggest that this is working. And as we just met with the state and the Green Mountain Care Board, is like, where is this all going? And it was overwhelming support by everyone there to continue on with this, because it's really working for the patient.
Right.
To have this patient-centered care, this kind of wraparound service, the right care at the right time and the right place. And so their goal is, because we get paid a little bit different per member per month for people that are part of this, and in our communities, we've got over about 39,000 covered lives with the Blueprint. So it's a great population to really do some additional great work with. So the goal is to provide more money into the Blueprint so that we can continue to add some more resources that wraps around the patient. And also, I think once we get the data management piece of it, because we're collecting a lot of data, but how our systems and the technology support all of this. So we're still building infrastructure that can help us evaluate that question more accurately. But early signs are yes, this is working.
Good.
Looks very promising. I mean, one of the greatest challenges, of course, with communications is how do we share information?
Yes.
And there is a tremendous amount of work that's being done by all healthcare providers to implement electronic health records that are interoperable and do intercommunication. And I know there's been a lot of work in Franklin County with that. We just finished a very significant project at Franklin County Home Health, which will allow us to better integrate our records with those of the physicians that refer to us, as well as the hospital. For patients that are referred to us, we can access the hospital's electronic health records. So when our nurse makes her first visit, we don't have to ask 100 questions. We only have to ask probably 20. But we have access to that information that will help to streamline care and prevent that. You know, how come they're asking me that question again?
Yeah, exactly.
That's
You know,
right.
you know,
We've all been
so,
there.
You know, and so I think we're working on it. You know, primary care, you know, when you go see your primary care, you know, the hope would be your primary care physician knows that you had a surgical intervention and why it was done, and that we're all having access to the information in a very timely way. So, you know, the computers, information technology are here to stay, and I think they'll continue to grow and will be a very, very important part of the solution to healthcare reform.
Excellent. So I want to give you a chance to quickly talk about prevention again, if there's efforts that you'd like to share about how prevention plays a key in someone's well-being and what your agencies are doing, or as a whole in our community, what kind of initiatives are happening to, as you mentioned, sort of the RISE thing, but some things that are already happening locally, wellness initiatives.
Well, one of the things that we've been doing is there's something called mental health first aid. And the way to look at that, it's just like all of us would look at a first aid training and say, okay, I understand that. So mental health first aid is meant to do the same thing, which is to take community members or various individuals in walks of life and just break down some of the barriers on understanding why someone may suffer from depression or anxiety or substance abuse, some of those things. So the intention is just to make people more sensitized, because there's no one who can figure out that there's a change in your life closer than a family member or a friend who knows you well. They can see there's signs, but they might not quite understand what they are. And what mental health first aid is meant to do is just to try to uncover some of the things that you look for, and then how to talk to someone privately about that to help them seek the help that they need.
So we can find out information about that by going on your website.
Yes, yes, because we do have another
course,
community session this fall.
excellent. And of course we have the wellness activities that are ongoing from the hospital that you collaborate with others. And Janet, any other things you'd like to add? We're running out of time here.
Well, you know, I think about the implementation of our Nurse Family Partnership Program, which is a prevention program to assist first-time low-income pregnant women. And we have had some tremendous successes with that. We're just beginning to start to get some of our outcomes, and they're very, very favorable, and we're very excited about helping our new families get on their feet in a very strong way. So.
Thank you. Well, it's been wonderful to hear of all the wonderful things happening that have led up to this and that will continue to happen. We're wonderful partners here, and thank you for all the work you do in Franklin County and for collaborating with all the other healthcare providers in our county. It's really making a difference, and we appreciate that. Thank you.
Thank you.
Thank you. Jen.
And thank you for watching. If you have any questions about our agency, Franklin County Home Health, or any of the topic that we discussed today, you can call our office at 527-7531 and visit us online at www.fchha.org. Thank you again for watching, and be well.